Our work originally was looking at what people with dementia living in nursing homes were doing in a daily time, 24-hour period. This was with people with dementia. What we found in a 24-hour period is that people with dementia were, spoken to or communicated with between 2 minutes and 28 minutes in a 24-hour period. So a lot of the time is spent alone and with very little meaning in their life. So what I started to do was to look at robots in terms of a way of connection, giving people a voice, enabling them to feel comforted. So the current study, which I'm talking about today, is with a robotic seal. So it's basically the size of a harp seal, about the size of a baby, 2.5 kilograms, and it's covered with tactile sensors. So we give it to people with dementia. They use it as a pet therapy. So when they get it, they usually don't know what it is or what it does. They stroke it, it starts communicating with them in terms of engaging with them, they engage with it. And so our study's been about what the sexual seal does if we give it to people with dementia. And to date we've got very preliminary findings, but what we've found is that we've had an improvement in sleep, a reduction in agitated behaviours such as walking. We use an actigraph around a person's arm and look at that. We've had improvements also in terms of quality of life through communication and also emotional response, so very positive emotional responses. The limitations are the cost. So the robotic seal, for example, is about 7,600 euros. So it's a lot of money, and people will often say to me, gosh, I could do a lot with that money. I could bring a dog in, a dog wouldn't cost very much, but the robotic seal doesn't bite. So I can give it to someone. We don't need to train it. It already is trained. In terms of infection control, we don't need to take it out for hygiene, etc. Strengths is very much that it can be a very individual response. So we can give it to one person and then use it again later on. Our trial has involved 415 people, and they're across the trajectory of dementia, so from very early stage to very late stage. We haven't noticed any difference in terms of the findings. It doesn't matter whether someone is in early or late stages, and also in terms of gender. But not everybody likes it, so there are some people who don't, but I guess we're all individuals. Some people don't like cats or dogs, etc. So some people don't also like the robot. Staff find it a good way in terms of communicating with the resident as well.